Senator Marshall, I know you're familiar with this recent Government Accountability Office report, but I want to summarize it quickly for my audience. Last year, $124 billion paid out for enhanced Obamacare tax credits. The GAO found that that system was subject to all sorts of potential fraud, with payouts to people who are dead, never existed at all, or they filed fictitious applications for people who did not exist. 23 out of 24 were approved.
Right. So, look, healthcare is in a crisis, and the last thing we want to be doing is throwing money away. To your point, the GAO said that there was 58,000 dead people that the government was paying premiums to insurance companies for an average of 9 months. 58,000 dead people. This one person's Social Security number was used 125 times. So the least we could do is eliminate the fraud. I give you one more data point. 1 out of 3 people on Obamacare did not make a claim that year. So a lot of people are fictitious headhunters that went out, signed them up for Obamacare. And look, I want everyone to have access to meaningful, affordable health care, but we can't be throwing away money like we are right now.
The Senate's going to vote on 2 plans this week. You have a plan. Lots of people have plans. Senator, you know this. My audience probably knows it, but I'll repeat it. Plans are one thing, votes are another. And if you don't have the votes, it doesn't matter what your plan is. I mean, it does matter, but it doesn't matter in terms of advancing it to the president's desk.
Yeah, well, again, I want to go back that healthcare is in a crisis, and what our plan does is put patients in charge, not insurance companies, and every day we're gaining momentum. No, I don't have the votes yet, but we're working towards that. Again, what we want to do is take money that we were given to insurance companies, put them into your healthcare savings account, and pair that with price tags. We want to give consumers exactly what the costs are and then let you make the choices. We believe, economists believe, that'll bring the cost of healthcare down for everybody, not just people in Obamacare, but everybody, some 20%. So yes, we have a plan. Yes, we're gaining momentum. We're working across the aisle, and I hope that we can get across the finish line. So again, I'm just taking one step forward every day. Momentum's on our side.
But for those of my audience, Senator Marshall, who wonder this question, it's not going to be solved by December 31st. So these premiums are going to go up, and these enhanced Obamacare tax credits are going to expire, right?
Right. And look, the premiums are going to go up even if we do add these extended. But the main Obamacare, which pays for about 80% of premiums for people under 400% of the poverty level, those are going to stay in place. There's the people over 400% of poverty level that are going to feel this really squeeze. But the real squeeze is the cost of health care for everybody, and that's what we need to address, and that's why we need to pass our transparency bill. Our price tag bills would do more to bring the cost of health care down than all these other plans out there. Look, tackling Obamacare is like tackling a buffalo that just ran through a barbed wire fence. And every time you try to set a piece of that fence free, you get poked by another part. It's complicated, but again, healthcare is in a crisis. I'm going to keep working at it.
The president seems to be a bystander in all this. Why?
Well, I never would try to speak for the president, but certainly he's blessed the most important component of our plan. And this is something we've been talking about for years, that he wants to empower patients, not insurance companies, that he wants to take these enhanced subsidies and give them to patients to put them into a healthcare savings account where they make choices right now. Look, I think this is a compliment from the president, that he believes that and understands this is a complex issue, and this is why the people of America elected the senators to figure it out. The White House is there to enforce, to take care of the fraud, all those other types of things. They can help us set up some type of a reinsurance, health insurance program as well. But look, this job is a problem for the senators to figure out, the House members. I've been working on this not for a week or two, but now for 8 years up here.
Senator, every time you and I discuss matters of public policy, I bring up what's going on at the CDC, Health and Human Services, vaccines, and the like. A lot has happened in the last 2 weeks. Are you satisfied with what's going on in terms of hepatitis B and other recommendations? Senator Bill Cassidy, not happy at all, arguing that the CDC is no longer in that particular aspect protecting American children.
Well, Senator Cassidy and I are allowed to disagree from time to time. He's one of my very best friends. I want to empower patients and doctors. I want the doctors to explain to patients, to moms, to grandparents, to fathers, of course, why their child needs this hepatitis vaccine. And I happen to think they don't need it on day one. But if you and your doctor decide you want your child to have it on day one, go ahead. I would rather have the immune system of that child develop a little bit and assess risk factors. Look, hepatitis B is a sexually transmitted disease, or else it's transmitted through sharing IV drugs as well from drug abusers. Occasionally, if there's a person with personal contact. But we identify all those things through the pregnancy, and if we're unsure of the status, yes, let's give that baby the hepatitis B vaccine. But I think this is another situation where the CDC is trying to empower the patient and let them make the decision along with their doctor.
Do you question the efficacy of the vaccine based on the data since 1992, Senator?
No, not at all. I don't question the efficacy of it. I've had the hepatitis B vaccine, but I'm saying a one-day-old baby does not need it. I want that immune system to develop a little bit, and whether it's at 1 month or 3 months or a year, if there's no risk factors, I don't see the upside in doing that. Look, I'm perfectly fine with the timing right now, the polio vaccine, the MMR, the DTaP, those types of things, but I see no rush. Again, hepatitis B is a sexually transmitted disease, or else, unless your baby's going to go play in a sand pit with IV drug needles, I don't see why the baby needs a vaccine at 1 day of age.
Kansas Republican Senator Roger Marshall, always a pleasure, sir. Thank you.